Hey guys, Dr. Jackson here. If you've ever woken up with your mouth taped shut because your partner was so desperate for a quiet night's sleep, you're not alone. I hear this story every single week in my office. People seek chiropractic care for all sorts of things, including breathing problems. My patients who have been diagnosed with obstructive sleep apnea or who just complain about fatigue from restless nights associated with snoring often ask if I have any recommendations or treatment options for them. The only options that their doctor has ever offered is the bulky CPAP machine, and almost everybody hates it. It's loud, it's bulky, it's uncomfortable, or sometimes they suggest that their spouse has recommended sticking some tape on their lips because their favorite TikTok influencer said that it would help them get a better night's rest. For some, these things work, but for most, I find that people hate them and that they're looking for other options. Before I show you these other options, though, I think it's important to know exactly what is happening with obstructive sleep apnea. Here's the deal. When you fall asleep, the tongue and soft tissues lose their tone. They flop backwards and either vibrate, like a flag in the wind, that's what we call snoring, or they completely block the airway, that's what we call apnea. Now, sleep apnea can be caused by a number of things, and today we're talking about specifically obstructive sleep apnea. That is where that tongue and the soft tissues relax enough that it completely blocks the airway. When you experience apnea, your brain wakes you up just enough to gasp and get the tongue out of the way. Oftentimes you won't even become alert to remember it. You fall back asleep, and then you do that dozens or sometimes hundreds of times during the night. And you can imagine the next day you feel absolutely wrecked. For the vast majority of people with simple snoring or obstructive sleep apnea, the problem is mechanical and neuromuscular. This means that we can often fix it or improve it without masks, machines, or surgery. In this video, I will run down a few alternative options that I present to my patients. I'll show them to you, explain what it is and how it works, some of the pros and the cons, hopefully to inform you that there are other options out there. It's also important to note at the beginning of this video that it is made with the intention of being informative and not official medical advice. So if you or someone you know is struggling with a health condition, you should always seek care from your doctor before trying some of these alternative options. So the first thing that everyone is trying right now is mouth taping. Mouth taping is super simple. You get this strip of stretchy tape, it goes on your mouth, and you go to sleep. There's lots and lots of different brands out there. You can buy them here. Really common one is ZZZ tape, or you can buy a ton of them on Amazon. But it's a really simple device. You just put the tape right across your lips, and you go to sleep. It's become really popular for a few reasons. Number one, it's really, really cheap compared to some of the other options out there. It forces nasal breathing, which has a ton of health benefits. And for some of my patients, it actually helps a decent amount. Typically, I'll recommend that we use it as a 1 to 2 week diagnostic tool. And if snoring drops and they're feeling better, then great, we're done. We don't have to go on to these other options. But what I find is for most people, the tape peels off, the tongue collapses anyway, the snoring remains, and quite literally becomes a band-aid, not really a fix for the underlying problem. So when the tape fails, the next most common step is something like the Snore RX. The Snore RX is an oral mandibular advancement device. It's a mouth guard. This mouth guard is designed to bring the jaw forward. So when everything relaxes down and blocks the airway, the mouth guard goes in and it elevates the jaw to allow more space for air to get through. It's really personalized. It allows you to boil it, and then you bite it, and then you can adjust exactly to a millimeter of how much advancement your jaw needs to open up the airway. It comes in two sizes, the regular RX and then the RX Plus. The RX Plus goes up to 10 millimeters, whereas just the regular RX only goes up to 6 millimeters. So depending on your size, you can choose which one you might need. I find that this one works really, really well for patients initially. And some of their own studies suggest that it can significantly reduce snoring up to 50 to 70% in some cases. But there is a downside. What I found is that after just a few weeks, maybe even up to a few months, patients start to experience a lot of jaw pain, TMJ dysfunction, and even have noticed some bite changes. So typically, I see these only work for a short while before we move on to something else, but it's still a good option that could provide you some relief, even if it's just something temporary while we try to find. So next up are these little nasal gadgets like the Nano Cap. It's basically a mini CPAP machine that just straps directly to your nose. It's super light, it's quiet, it has these soft silicone buds that go inside of the nostrils, and it provides a gentle airflow designed to overcome some of that restriction in your airway. It's great for travel. It's way less bulky than the CPAP machine. And I have seen them help. If you're big and you have a big tongue and your tongue is the culprit, which for most it is, this tiny airflow device doesn't have enough pressure that a usual CPAP machine would to really overcome that blockage. And so it is smaller and less cumbersome than a CPAP machine, but it is still on your face every single night, and it only works while it's in place. Now, most of these that we've talked about so far are passive treatments. They're indirect treatments to the underlying problem, meaning they just treat the symptoms but not the cause. And as a chiropractor, I've built my whole practice and profession on getting down to the root cause of people's health conditions. And so, keeping with that mindset, I want to show you a therapy that I reach for first in most of these cases, because it does just that. It gets down to the root cause. And so enter the Excite OSA. OSA, again, is obstructive sleep apnea. It's an FDA-cleared device that strengthens the tongue and upper airway muscles with gentle electrical pulses. You pop this little thing in your mouth for about 20 minutes while you're awake. I often have patients do this when they are watching TV, or when they are catching up on emails, making dinner. Really, just fitting it into your daily normal routine is all it takes. So this device has 4 gel electrodes, 2 above the tongue, 2 below the tongue, that deliver rhythmic, painless contractions to the tongue. This starts to train and strengthen the tongue while you're using it. The typical treatment is supposed to be consistent, daily sessions, and we'll do that up to 6 weeks. After the initial treatment period of 6 weeks, patients often use it 2 to 3 times a week just for maintenance. Things I love about this one: there's no mask, no jaw pain, no tape, just stronger muscles that hold the airway open on their own while you sleep. In most mild to moderate cases of obstructive sleep apnea, the tissues are just weak or out of shape, not permanently damaged. Think of it like the deep core stabilizing muscles of your lower back. When they get weak, you become predisposed to back pain and injuries just during normal everyday activities. Similarly, the deep airway muscles can get weak, and when this occurs, you end up snoring and with apnea. Well, what's the treatment then? Well, it's the same approach: rehabilitation and strength training. That is where the Excite OSA, in my opinion, is so exciting. Now, when everything else fails and the symptoms are truly severe, and we're confident we don't want to mess around with the CPAP machine any longer, the Inspire implant becomes an incredible option. This tiny pacemaker-like device syncs with your breathing cycles and just gently moves the tongue forward. Some of their studies have suggested 70 to 80% of patients experience long-term success, which is life-changing. It works like this. In obstructive sleep apnea, the tongue falls down, gets in the way of the airway. When that occurs, we become startled, we wake up, the tongue moves forward, we get a breath in, and then we do that repeatedly throughout the night. But when we have this device implanted underneath the tongue and it stimulates those muscles, it opens it up when we breathe and then relaxes. And that way, we are able to get adequate amount of breath. This is a way cool device, but it's pretty invasive. It's a major surgery with a big price tag. I believe it is covered by some insurance companies, but even still, deductibles and out-of-pocket costs can be pretty high. And so I save this one for true conservative care failures after we've exhausted all of the other options. So in review, I want to give you my conservative treatment flow. This is how I recommend all my patients to go through this process. So first will be to do a sleep study. If you haven't ever done one or it's been a while, going and seeing a sleep specialist or ordering one of the at-home sleep studies online and having it sent to your home is a great way to get a good baseline of exactly where you're at. After that, let's do 1 to 2 weeks of diagnostic mouth taping. If it works and things are improving, great. But if not, then we try the next step, which oftentimes will be the mandibular advancement device like the Snore RX. Try that for a couple of weeks, see if that helps. More often than not, we end up here at the Excite OSA tool. And we do this for 6 weeks, a solid 6-week trial to see if it will help. More often than not, it does. But at the end of those 6 weeks, I always recommend that we do another sleep study, another sleep test to see how much progress we have made from that initial baseline. So we do a test. We do about 8 to 10 weeks of treatment. trying a few different options, and then we retest our sleep. And if things have improved, then we're on the right track, and then we just continue that treatment, continue the maintenance, and things are great. If they don't, that's when I will make a referral to a doctor who will do one of these implants that can help with improving sleep long term by getting that tongue out of the way. Ultimately, all of these options are ditching the CPAP machine, no more devices at night, and just better sleep and better health. So in conclusion here, guys, I just want to make one final point that there's nothing wrong with trying more passive therapy first. However, if you're someone who is self-motivated and has the discipline to be consistent, then I'd suggest trying the Excite OSA as soon as possible. But either way, I hope this video really helped inform you of some alternatives to the mouth taping phenomenon that's going on, some alternatives to the CPAP machine, and to finally find a way to sleep well, wake up refreshed, and ultimately keep your partner happy. Thanks, guys. Take care. Bye.